this morning we're turning our attention to something that affects thousands of lives every year, and that's cancer awareness and early detection. Our guest today is someone deeply involved in transforming how we approach cancer in primary care.
Joining us is Dr Bushra Khawaja, a highly respected GP partner and primary care cancer lead for RM Partner Cancer Alliance.
Yes, and not only does she sit on the collateral pathway group, but RM Partners, but she's also a trustee for the Children and Young People's Cancer Group, an honorary clinical lecturer at Imperial College School of Medicine.
She's here today with some vital information on early cancer detection, why it matters, and how communities like ours can be better informed and proactive about it. So, Dr. Bushra, welcome to the show.
And welcome to Salam Britain this morning.
Wa alaikum assalam. Thanks so much for having me, ladies. It's a real pleasure to be here.
No, it's we're very happy to have you here today because obviously this is a very important matter to discuss, and it all matters in how soon you can find out and how soon you can get treatment. And that's the big thing here, isn't it? It's a matter of life and death in terms of when you find out.
So without wasting much time, let's start with the basic. What does your role as a primary cancer lead actually involve?
So
I know you're many things, Bushra.
Yeah. So during COVID, a job came up with the Cancer Alliance, and I'd never actually heard of the Cancer Alliance before. So in the UK, there are 21 cancer alliances. They're funded by NHS England. And they basically look at data around cancer, everything from screening to early diagnosis to treatment, and try and work out where things are going wrong and then focus on that. So the job was actually for a lead for Hillingdon, so I applied and I got the role. And since then, my awareness of how important this topic is has just really grown. Let me just give you a statistic which you may or may not know. Our lifetime risk, so 1 in 2 of us will be diagnosed with cancer. So it's not an abstract idea. This is something which is going to affect a lot of us or people we know. But as you said, Shaz, it's all about early diagnosis. So it's not a death sentence, because a lot of people are scared of the word cancer.
Yeah,
but
that word, going through, your GP or doctor and sitting there. I know I've met people when they say, "Oh, I was okay," but when they said the word cancer, it was like I couldn't hear anymore. I couldn't think anymore. It's hearing that word. It's got so much attached to it, but we have to face it. As you said, the statistics are very high.
And switch it to a positive story. So if I give you an example of bowel cancer, if it's picked up early, so stage 1, you've got a 90% chance of surviving for 5 years. And if you flip that to the later stage, stage 4, that drops to 10%. So from 90% chance of survival to 10.
Yeah.
And all because you seek help early, get diagnosed early, get that treatment earlier.
I mean, I do know some people that say, I'd rather not know.
Yeah.
So I think, talking about it today, us discussing it, it's really important for those people, because people just say, there are people I know that are 100% have said to me, I'd rather not know, and I'd rather just carry on.
I think a lot of people do miss out the early signs when they have got issues and not go to the GP, just because for the fear of the dread hearing that if it comes to that bit, because it's like, we want to live like an ostrich life. Like, you just want to bury your head in the ground and see that you're safe.
And completely, Shaz. So from what you said, that people don't want to know, but actually what our job is, or my job, is to tell people, actually, you do want to know, because you can probably do something about it.
And that's the 100%.
If you catch it early.
If we catch it early, then there is hope. There is hope to catch it early, as you said, and get treatment and still live a happy, fully fledged life.
Completely.
And this is what seen a few wonder stories. A friend of mine, I think, 2 years ago, when she moved back from Dubai, happy family, the kid starts GCSE, the high school, they move back from Dubai life. A few months down, she has some issues. She goes visit the GP, and there it is.
Yeah.
That word is shook. And now she's a survivor. So basically, she's overcome the odds. She's now doing what she wants to do. 2 years down after chemo, and everything. So it's
yeah. I mean, we've had guests as well that have actually been survivors, and alhamdulillah. But that's because they've taken that journey where they've they've been informed, like by people like yourself, and then they've taken gone through the treatment and been able to tell us a story about it.
And that's what it's all about.
Yeah. So now the next key question is going to be, what type of cancers are often missed or misdiagnosed?
Yes. So this is a really good opportunity for me to tell you about a couple of campaigns that I've been working with the Alliance. So let's talk about bladder cancer. So women, it's very common to get urine infections and symptoms like burning, going more often, blood in the urine, and even actually as you're getting a bit older and getting to that perimenopause, urinary symptoms going more often are really common. But did we know that actually these symptoms can also be bladder cancer?
Oh, wow.
So,
so where you think it's just UTI?
Yeah, so I've been part of a campaign. I don't know if we can get the poster up, but you should be able to find it online. It's basically telling women, because women are the ones who are diagnosed with bladder cancer later, because they just presume, well, it's an infection, it's my perimenopause, and it might be. I'm not saying it is
And the poster
cancer.
is up. I think we
There
can
we
see
go.
it over there.
So blood even once, and just things not getting better, infections, burning, needing to go more often. Just see your GP. It probably isn't cancer. It probably is an infection or
I think
perimenopause.
I need to book one.
Yeah. I'm just trying to think
You're both
which of those
okay.
boxes I tick.
So it's probably more likely perimenopause, and you probably need some vaginal estrogen or something, but don't miss out on the chance of diagnosing a cancer earlier. I'm going to just keep saying the same thing because that's the key message.
So, but there must be other ones as well that we kind of miss, because it's not. So I don't know if this is true or not, but somebody said to me, "Cancer's not painful." You don't know. So
I mean,
it's like silent.
You see, you can get both, and this is where screening comes in. So screening, there's lots of NHS screening programs that's looking for cancer before the symptoms.
Yeah.
Actually, bowel's probably a good one to talk about. Like, nobody wants to talk about your bowel habits. It's people find it embarrassing.
But I always associate bowel with like problems more with
The
male.
gut.
No, I always think it's always more male. I don't know why.
So Shaz, do you know women are diagnosed with bowel cancer later than men because women just ignore the symptoms?
I think also we just battle on.
Yeah.
We just don't think, like, when you have pain in your body, and I'm
got
not
a
going to lie,
better
I've been
pain
having pain in my
threshold.
shoulder.
well, this is
And
it.
you just ignore it. You just carry on. You just keep carrying on, like, I've got this to do, I've got to do that. And you kind of ignore yourself and forget that even now as I speak, I can tell you I have pain in my arm, that you kind of just...
You're completely right. We're stoical. And actually, this month's campaign, so bladder cancer was last month, this month's campaign is bowel cancer. And actually, another poster might come up, which is all over the place. So you might see me across buses and tube stations. And it's really just saying, now, actually, bowel cancer is one that... At the moment, majority of bowel cancers are picked up late, stage 3 and 4, where there's less chance of successful treatment. So I've put myself out there. You'll see me with pictures next to a toilet roll, just telling people that if you have a change in bowel habit, blood, tummy pains, a lump in the tummy, anything that's not right for you, any change, again, it probably isn't cancer, but just go and talk to a doctor, go and talk to your GP.
No, that's great. Bushra, that you're doing that. But I also got a message. I don't know if it is an awareness month for breast cancer, but it was a poster of what to look for. So it's like just your own screening checkup.
Yes, I did come across that, and it's really important to know what your normal is, because if you know what your normal is, then if there's a change, then you can seek help. And that actually brings us to another NHS screening program, the mammogram. Women are invited after a certain age for mammograms, and again, people might put it off. It's embarrassing. You've got to get undressed. Might be a little bit uncomfortable, but again, it's
your life at risk
it.
at the moment. And I know a lot of women do put off with the cervical screening tests as well. They're like, oh, it's uncomfortable, I'm not going to go for it. But it is important because once it's there, and if it spreads, there's no coming back out of it. So now talking about that, the stigma or the fear in our communities, particularly South Asian and Black communities, have you come across any that is particularly that stops people from coming and going to see or speak to a health professional or a GP?
I mean, it's very common, and as I mentioned, that the stats show that ethnic minorities actually seek help later, and then when they do seek help, it takes longer for them to be referred as well.
Oh my gosh!
Yeah. Now
nobody's talking about that.
Yes. So, I mean, we're not saying that doctors are racist. I don't think it's as simple as that, but maybe it's how some cultures present their symptoms. They might not present in a typical way. So ethnic minorities are definitely going to the doctor later, and then when they do go, it takes longer for them to be referred. And then there are cultural taboos. I had a lovely session in my mum's mosque, in West Ealing Mosque, talking to 70 women on a Sunday morning about cancer. And it was such a great opportunity to talk about, actually, let's talk about prevention, because 1 in 2 of us will get cancer, but what can we do to prevent cancer?
Important question, yeah.
Important question. Now, in year 8, all of us get that email about the HPV vaccine for our children.
Oh, yes.
Let's talk about that, because
we always pushed it aside, yes.
Well, this is it, because there's so much misinformation, or people think, oh, it's only for for people who are going to be sexually active at a young age.
Yes.
No.
That's a taboo.
It's a taboo. So the human papillomavirus, some strains, increase your risk of not only cervical cancer, head and neck cancers, anal cancers, rectal cancers. So whether you have a girl, whether you have a boy, get them vaccinated, because you will literally remove or almost remove the risk of certain cancers. Why would you not do that for your child? So I was in this mosque and I was talking to these women who were just saying, right, I'm going to get my child vaccinated. So that was so great. So yeah, there are certain things in our culture, and maybe cervical screening as well.
Yeah.
So I know this HPV virus because we had a big debate and big campaign in our living room.
Okay, let's
because
hear
my
about
daughter
this.
was involved with it.
Yeah. To be honest, I'm a bit sceptical about it as well, and I'm just wondering how long these vaccinations have been around, and what is because if we don't know the long-term effect, I mean, okay, yeah, it's for prevention. But how long they've been around?
So Shaz, I'm so glad you asked me this, because these are all legitimate concerns that everyone has, and I want to talk about it so that I can reassure people. So the vaccine's actually been around for a very long time, and I don't know if you remember that we used to think that children needed multiple doses, but now we've realised you only need a single dose. So there is many years of evidence, and the stats actually show that thousands of cancers have been prevented and will be prevented if children are vaccinated before they're exposed. And it has to be before they're exposed to the virus. And this virus is very common, and majority of people at some point in their lifetime, because it's skin-to-skin contact, will be exposed to the human papillomavirus. So, you know, who wouldn't want to protect their child from cancer? So it's safe. It's been around for years. It's one shot, and it can literally save your child from the risk of many, many cancers.
I mean, I've never had this virus. So what does that mean? As in, like, you don't get it at a certain age, or is it for a certain age?
So look, it is through skin-to-skin contact. So often it is through sexual activity that this virus is spread, and which is why it's so important to get children vaccinated before they are sexually active. So that is the commonest way of acquiring this virus.
So that's why they've picked year 8 to do it.
Exactly.
Okay.
Exactly.
Before it was 2. They used to give 1, and there was a booster around year 9 or 10 or something like that.
That's completely correct. So before there used to be a course, but now they've realised you don't need it. 1's enough.
Amazing.
Even
That's
better.
just from one child to the second one, because the second one just had 1, and my son's taken it as well, because like I said, my daughter worked with this and I wasn't aware of this. I just ticked it. I was led the school, you're doing some vaccine rollout. I'm not an anti-vaxxer, so I was like, okay, there hasn't been much other side effects. Okay, all right, you guys are getting it. So
What?
no, but yeah, it's something like, see, I know the school are not going to do something. For example, when it came to the nasal spray flu thingy, we understood it had certain things that are, like as a Muslim, my child shouldn't be having it, but there's injectable ones as well. So I was like, okay, if need be, like my eldest child, at that time she needed to travel, vaccine was necessary, she got those.
Yeah, but you got to understand why people do feel really worried about vaccination stuff, because we've seen the effects of things like, for example, COVID, and there's still, it's controversial. People still talk about MMR, what the effects are. These are lots of really big
Shaz,
conversations.
I think these conversations are so important to have.
Yeah.
Because people have concerns, and with the MMR, when you look at the evidence, it was completely dispelled, and it is so unfortunate that even now. Obviously people think it was a doctor. The doctor said it would cause autism, but that evidence was completely dispelled. And unfortunately, we have seen measles and other infections increasing because parents are worried about it. And I think it's so important to talk about it, because if you talk through your concerns and you're reassured and you talk to trusted people who back it with evidence about safety, and if a parent feels secure, then they are able to go forward with that really important vaccine.
Yeah, I would like to give a shout out to my GP. If you're listening to this,
I know
you've been amazing. You were amazing when I had my 3, and he went through the book with me, and he said, these things are important.
Yeah.
And sometimes, I rush through my GP. I email them saying that I generally don't come to the GP, but if I'm contacting you now, that means I need urgent help. It's something I've tried everything over the counter. So please.
Did he tell you that if you need urgent help, don't actually call, don't contact the surgery,
that sort of,
go to the hospital?
Certain things. And I was like, I need to discuss. But I feel, you need to have that relationship with your GP or your practitioner. And it helps. I've been with that like 18 years of my life with the same GP. And my only concern is if he leaves one day, what am I going to do? Because you've got the comfort level there.
Yeah.
But like you said, it is so important to miss those diagnoses just because of your negligence or your ignorance, especially when it comes to us women. South Asian women, because we want to be like superwomen, want to do it all, never show pain.
Yeah, sometimes it's not even a choice about being superwomen. It's a natural biology of women, or being feminine and caring, a bit more nurturing. That whether you're mother or not mother, to be a bit selfless and always giving more in terms of care to others, and so it's really important that we do check in with ourselves.
So I'm going to ask you an odd question. Now, you've been to a mosque talking about the awareness of cancer. So how do you think the other mosques can reach out and play a pivotal role? Because a lot of communities have got these big mosques, or they cater for women, or they do have those hours in the mosque that it is not required for salah or for the men to congregate.
Yeah, so I was just going to say that actually, before you answer that, Bushra, how is the mosque people, the committee or the people been with you coming in to talk? Are they been welcoming or accommodating?
Yes. So West Ealing Mosque is basically, my mum runs the women's section, so I kind of had control there. However, there is great work happening. So I should really give a shout out to the British Islamic Medical Association. So
BIMA.
BIMA. They're running, in October, they're running cancer awareness sessions in mosques. So I think mosques are a great place because you've got the whole community there, you have all the different generations there. And the other thing, going back to your self-care, Shaz, the other thing I was talking about, going back to prevention, what can we do to reduce our risk of cancer? Did we know that actually being a healthy weight, exercising, with bowel cancer, increased fibre in your diet, these are all things which, to be fair, they reduce your risk of a lot of things, the whole cardiovascular risk and diabetes risk, but they also reduce your risk of cancer. Smoking, we might say, well, okay, we're Muslims, we don't smoke. Well, we do. And culturally sensitive, shisha, how many cigarettes is one shisha session equivalent to? Question.
Don't know.
I think it's
between 15 and 20.
Yeah.
Does that make a bit too much?
100. So 100
Oh
cigarettes
my gosh.
equals 1 shisha session.
Okay.
And in our culture, it's kind of like, it's okay, it's only shisha. It's
Some of them, no, but some of them, I don't know if they have, not all of them have tobacco, right? Or they all have tobacco.
They all have tobacco.
They all have tobacco.
tobacco.
And what about
yeah.
The
what's
vapes?
the other one? Vapes, yeah.
What about vape?
So vapes.
That's the new trending one. Like
okay.
everybody's like, forget shisha, now we get the vapes.
I don't know.
So
It's
that-
battery operated. I mean, it's got its own.
I mean, that's a tricky one because the evidence for that will now be looked into. So
Because it's still
Yeah.
it's not been around long enough to see.
well, this is it. So, I mean, I would say get out there, move, have fun, and put your shishas and your vapes aside.
You know what?
For the
But I
decoration
really like-
purposes. Yeah, you know, a nice shisha in the corner looks nice in the corner.
love
Oh
that,
gosh,
Nevish. You can
she's
have
it
that.
for decoration. No, I'm
Why
saying
not?
it's a really good question. I like the fact that you said that. You know what? We kind of need to check in with ourselves, and I don't mean like when you wake up in the morning and you're doing your hair in the mirror, but just generally check in with yourself, and ask that question.
Yeah.
What can I do to reduce my risk of cancer? I think that's a really good question to
Yes.
ask ourselves on a daily
Yeah.
basis, because that might change the way we are, how active we are that day, or what we eat.
And
You know?
prioritize yourself as a woman. Our families love us, but
We should love us as
but
well.
we tend to get left behind, and the kids are a priority, and like we come first.
We forgot to love ourselves.
Yeah.
Trust me.
Yeah.
We go for the superficial things like clothes, makeup, this and that, but internally we try to hide pain.
Yeah.
And we're very good in that. It's like we could be awarded the best actors.
Yes.
But like I say to my mum as well, if you're in pain, speak out. And if you're watching and if you've got issues, please, the health provider, your GP is just around the corner. I know it is painful calling and being on the line or emailing or waiting for an appointment. Even if it's not for today, get it done. Like, in 3 weeks' time, you will get an appointment. And it's better you have spoken, you have checked your issues, and they have reassured you that you've got that peace of mind for the rest.
Yeah, and we shouldn't have to just wait for pain to come. We should, before, as Bush is saying as well, check in with ourselves in terms of taking care of ourselves and, prevention. By doing things for ourselves beforehand, before it even gets to a stage where you feel like something's a bit off or something's not right. But anyhow, Bushra, tell us a little bit more about, you're making these awarenesses in the masjid and stuff, and alhamdulillah, you've had some positive feedback in terms of people's questions and concerns, and you kind of helped with that. But going forward, what more needs to be done for us to get more of this kind of awareness?
I think we just need to continue the conversations and making sure that we are engaging with the community where they are, physically, where they are emotionally, what they want to talk about, what their concerns are. And actually, I am broadening my work. You mentioned the CCLG, the Children and Young People's
Yes.
Cancer Association.
That's coming to that.
Yeah, I've recently become a trustee.
Oh, done.
And they are a great organisation. And one of their biggest focuses is actually opening up the conversation to all the population. And they want that patient experience from all different parts of the community. So yeah, I think what we can do is just open it up to everybody, make it a safe thing to talk about. Cancer is not scary.
Yeah.
What about like how to prevent or use preventive measure for children? Like we've talked about women health.
Yes. So children's cancer is thankfully rare. However, it is really important to pick it up early. So the CCLG are actually running a Child Cancer Smart campaign at the moment. Hopefully we'll get a QR code up so you can learn more about it.
Yes.
But it's about noticing a change. So
there we go. We've got this image that has got...
We've got this image of a summary of different symptoms that children can have with cancer. But actually, if the key message that I want to give to people is, if there's a cluster of new symptoms, if there are symptoms that are persisting, if there's something that's getting worse, don't ignore it. And actually, if the GP or the healthcare professional dismisses it, which I don't blame them, because often the symptoms can be maybe like a persistent fever. So it can be something which is common with viruses. But I don't know if you heard about Jess's law or Jess's rule. So Jess was not a child, but a young person in her 20s who unfortunately went to medical professionals more than 20 times and was dismissed because she was young.
Yeah.
And this law has now been brought in that if the GP sees somebody or a health professional sees somebody 3 times or more, think, reflect, investigate, refer. So it is an important thing to think about.
So can we have the QR code again that the people can...
Yeah, it was up on the screen. But okay, so let's just say, hypothetically, Bushra, someone is concerned, they've got, you know, something that's not right with them. What's the steps, what's the process of what should they do and what should they expect?
The first point of call is primary care, so it is your GP. And I know historically it's been really difficult to contact your GP, but things are changing and online access is being brought in. So even, you know, you don't even have to pick up the call. I know it's variable in different places, but talk to your GP and talk to them soon. Don't put it off because as we've said, it's about picking the signs up early.
Thank you so much, Dr. Bushra, for joining us today and sharing your expertise, because cancer can be a scary word, but with the right knowledge and early checks and support, it doesn't have to be a life sentence.